All right, good morning, or good afternoon, I guess now, everyone. Welcome to the KPQC Learning Forum for January. As you're getting settled in, please put your name and agency in the chat, and we'll get started here in just a moment. Okay, I'm starting to see names in the chat. Welcome. I'm just going to continue to admit people into the group. Please continue to put your name and agency in the chat if you're just joining. If you have any trouble hearing, please just enter a message to me. I'm Tiffany Burrows in the chat, and I will get your questions answered. So far, we're going to, we'll probably admit everyone in, and then I will close the chat until Tara is ready to open that up for questions and comments. Okay, it's 12:01, Tara. I think we're ready to go ahead and get started. I'm just going to continue to admit people as they come in, and I'll just keep watching the chat for any issues. Welcome to the January KPQC Learning Forum. We're glad to have you all here. Happy New Year. And I will turn this over to Tara. Please, if you're just joining, enter your name and agency in the chat, and we're ready to start.
Hi, everybody, and Happy New Year. I feel like the last 25 days have felt like 45 to everybody probably on this call. It's just really great to see this attendance first thing out of the gate this month. Unfortunately or fortunately, you're going to hear a lot of my voice today, but I want you to know that this is probably one of the only times this year that that's going to happen. We have intention with more dynamic collaborative work now that we're rolling with fourth trimester initiative to engage all the experts in the field, some new faces, some patient perspectives, and certainly to allow our champions throughout the state to give feedback and provide their insight. However, today it's me, and then I would ask for lots of input and conversation. I don't care if we don't get through the entire content today. If there's something we need to stop and pause and have good discussion around, that is absolutely the point of this learning forum. For those of you that haven't joined us before, and I think there's some new faces and names that I see, the learning forum has two purposes. It has a general purpose.
Oh. Hang on just a second, Tara. I'm sorry.
Did I mute again?
Yes, hold on just a second.
Did you mute me, Tiffany?
I think I did that. I'm so sorry.
I got good news for you, Tiffany. You're not the only one in my life that probably wants to do that. It's okay.
I'm so sorry.
It's all right. Now you owe me a Mountain Dew.
Sure.
What I was saying was Canis Perinatal Quality Collaborative created learning forums years ago under the preface that we wanted to do collaborative work as a state during our lunch hour. Not always perfect timing, but a great opportunity for us to share ideas about the work of maternal child health in Kansas. When I jumped in with several new folks to focus on the maternal side of things, we felt like we could use the learning forum in a dynamic approach to the specific initiative we chose, called the fourth trimester initiative, surrounding postpartum care and transition, but also to engage folks that may not be directly involved in the initiative, to keep them informed and to, again, inspire change, have conversation that was forward thinking. So as we start the new year, I want you all to kind of rethink learning forums as dual role. Those that are engaged and enrolled in the first trimester, of course, you're our forward champions and you're doing such great work. I'll share that in a minute. But for those of you that aren't enrolled yet as a site or as an agency in the first trimester work, that's okay. We're really happy that you're here and we want you to stay involved and to ask questions and to be dynamic in your involvement. So name, I think, or roll call, I think Tiffany just took care of this for me, except for, if you'll turn the chat back on, Tiffany, I'm not going to be able to read these right now, but I'm going to ask Tiffany's help later to go back. I want to know from every single person on the Learning Forum right now, one New Year's resolution for your facility or your center or your place of work, or however you're here, whyever you're here, representing whatever dynamic of maternal child health, one New Year's resolution for 2022 regarding a goal. And that's all I'm going to say. So I'm going to give you a minute or two, type those in the chat, and I look forward to going back to those later. Tiffany, do you see them coming in?
Yes.
Awesome. All right, you guys keep chatting or keep telling me your New Year's resolutions, and I can almost predict that there's some conversation about COVID, staffing, and funding, but I hope there's some more dynamic conversation happening as well. So again, I'll go back to those and share those with you in February. Our agenda for this next 54 minutes is pretty straightforward. We always involve something called rapid response, which I feel like is my obligation to share with you cutting edge information or the latest information or resources of information specific to our work with moms and families in Kansas. We'll do that first, and then I'm going to provide you with some updated state and national data. Again, if you're not paying attention to local and state level outcomes, then really how do we know where we are and where we're going? How do you find your specific county data will be embedded in that conversation? Then we're going to talk through specific policy change. I'll tell you where we expect to be on the first trimester work. For those of you that are not enrolled, you'll like to see what hospitals and birth centers are doing. You'll be inspired by some of the things that are happening across the state. And then how do we make that into a policy, a specific goal, but again, a broad review and fix of some gaps that we have in the inpatient setting, and how can we help each other to create new policies and procedures. We were going to do some case studies, but I realized that we're not going to have time for that today, and that's fine. We have more important things to do today, and then we'll talk about the upcoming Learning Forum schedule. First, which is probably the most exciting part of my job, is when we have yet another hospital or birth center sign on, and sure enough, Neosho Memorial signed on about a month ago. That is phenomenal. I'm loving working with them already, and I'm showing you a quick list. But look, I almost need 2 PowerPoint slides now with the numbers of birth centers and facilities in the state of Kansas who are now enrolled. I would tell you that we have 2 more in the pipeline. Pratt sounds like they're going to be on board pretty quick, and we've got one more from the Kansas City area that I'm working hard with and excited to announce that soon. Again, be proud of who you're hanging out with. Now a total of 27 birth settings, which sounds like a low number. My goal was 33, if you remember that about 1.5 years ago. But I'm really, really proud that we're gaining and that we're actively affecting over 73% of the births that are happening in Kansas. Also a quick reminder that impacts both live birth and stillbirth Kansas rates. With over 27,000 total, or 25,000 total. A real quick note, you're going to see me blow through some resources. Tiffany is taking notes. There are some websites and some apps that I'm going to share with you next as we talk about rapid response right now. But all of these resources she will send to you in a follow-up email to our listserv. All of them will be available on our renewed website. All of you know it has not been perfect, and so we worked really hard to update that, and those changes are coming up. What you see on your screen now is an example of a constantly changing and updating resource that we want everybody to know about. This is our fact sheet for the first trimester initiative. It talks about why, it talks about who, it talks about goal setting and specific programs at every level of care. And even though I just realized my name is misspelled on there, we're going to let that go. I missed that moment, but everything else on there should be updated. If you need a copy of this, email me, but it will be up on the website very soon. Exciting stuff in one-stop shop. Most of you probably already know you got an email from several of us about this really important day that happened back over a month ago. The White House had a maternal health day of action. Lots of important goals set out by the federal government, including funding opportunities, goal setting, AIM specific bundles were talked about a lot. But I wanted to draw your attention to those of you that are enrolled and those of you that are thinking about becoming enrolled in fourth trimester, the specifics that are outlined with that arrow. Creating a new designation of the quality of maternal health services for our nation's hospitals. And more specifically, this designation is intended to be awarded to those hospitals that participate in a collaborative program aimed at improving maternal outcomes and implement patient safety practices. If that doesn't scream KPQC and fourth trimester work, I don't know what does. So be proud of Kansas. We are doing the work. We are working on doing the work, and we continue to improve. But wonderful that we're going to get support, forward progress from the federal government down. Very exciting day. Again, that website at the bottom will be mentioned in your resources. I'm also going to touch on this really quickly. I had a phenomenal reach out and connecting dots. This is again the goal of the KPQC. We had a hospital that reached out about perinatal loss. A smaller hospital that said, we don't have all the resources, but I know there's something in Kansas, Tara. 5 seconds later, via email, boom, 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 KCC got involved, Advent Health Shawnee Mission got involved, and this is just a quick online resource that I shared back with them. There will be more information about that specific resource development that I'm going to ask KCC to involve at our next month's learning forum. I guess my point about this slide is we have to remember in the middle of all this why we're here. And fortunately, we have great resources. Unfortunately, it's part of why we're here. Perinatal loss, maternal loss, created a scenario that we needed to fix. And finding resources for our families and for our birthing persons and for everybody who experiences an adverse outcome is part of our job. So great job for the reach out. Again, lots of collaborative folks that jumped in. If you need help or need a resource, come to me, ask what you need. If I can't find it right away, I promise we will. But twofold request, don't hesitate to ask, and don't forget, in the middle of the good things that are happening, we've got some families struggling, and we have great resources within our state. Outside of our state, I'm acutely aware of things that come across the media. This is an experience, obviously not in our state, but made national news last month of law enforcement couple, 1 month postpartum, and they both self-inflicted harm, and both of them ended up passing. I just need to say to you all that this made national news, but I think all of us probably have heard or been witness to or experienced the entire nation, certainly at the state level. There's a lot of mental health needs coming. And this is, in my opinion, a really horrible outcome of potentially a postpartum related event. I don't know all the details, but I want you all to know, pay attention when you hear things on the media, see what your state is doing in response, and ask questions of all of your couples and your families and your moms. What can we do to help? I also want to let you know, Casey and I are participating in a really, really great patient-centered approach. So it's all well and good for us to sit at our desks and come up with policies, to ask patients questions, to change how we approach the postpartum sector. But what do the patients need? And what are those who have lived experience with a basic birth experience that ends well, but also with those, and more importantly with those who have not had a good outcome or have experienced some type of an adverse outcome. Even if it's just that they believe it's an adverse outcome, and perhaps on paper we wouldn't claim it as such. This has been a phenomenal experience for Casey and I so far. We just got off a recent call with Mama's Voices, a great nationwide group. And we will share more information and how to embed the patient voice in the local and state level work that we're doing as a vital component to the forward progress. I also would say that one of the things that I'm learning quickly, and as I listen to patients and I pay attention across the state, the irony that the postpartum period has not gotten the attention that it needed, and the fact that we identified it as the perhaps the biggest problem in our state with why we're losing moms, is because of this experience right here. And I saw this graphic, pulled it off, and wanted to share it with you. Isn't it true that we focus so much on the antepartum or the pregnancy piece? There's a delivery, and then we see her one time. This might be the best visual for saying this ain't cutting it. And so again, look and see what your literature says, and pay attention to what your patients are saying back. This is patient-driven literature that says, what'd you guys do? You dropped us. And I would tend to agree with them. So again, it's embedded in our fourth trimester work to essentially mirror the left side with the right side. Patient-specific, provider involved, but not driven, goals for postpartum adjustment. The mom card. This is a specific state level project. Again, we'll work through this next few months. Created with a great collaboration between March of Dimes, Delivering Change, Fourth Trimester, KDHE, name them, and they were involved. Obviously, the post-birth piece on the right-hand side that most of you should be able to recite to me at this point, and embedding those in your hospitals. Phenomenal work through A1 training and using that to educate moms on the red flags and the yellow flags and the green flags in the postpartum setting. The left side is the Kansas specific work. And of anything that I've seen come through in the last couple of months, this is something that I hope that we get going pretty quick. March of Dimes has paid for printing a lot of copies of these for all of you that are enrolled. It's a two-sided card. We will talk about integration of this at the birth setting piece, and how you can use the front side to be your, again, remember you've got the magnet on the mom card. That's the same thing. That's the post-birth piece. And on the second side of that is what you see on the left-hand side of the screen. Mom specific information when she's discharged from the hospital that she can keep with her, take a picture of it on her phone. She's got critical information that she can share with anybody that's involved with her care or that of her infant. Again, we'll talk about the rollout, and when your facilities will get that in the coming months. A couple more resources I just want to put in front of you. I get lots of information about lots of resources, and as much as I can put that back into the facilities, agencies, and the educators on this call, it helps me feel like we're getting information out faster. KDHE, the Maternal Child Health Division, is doing a wonderful thing with the monthly highlight, Group B strep, COVID and pregnancy and breastfeeding. Lots and lots of important health outcomes that they focus 1 month or each month on a different topic. They send the information to us. You'll see that Tiffany or KFMC sends it out to our entire listserv or anybody that's enrolled. And it's a great way to educate yourself, your staff, your patients, your students, with the latest education. So look for those monthly updates coming. Then these two other resources that are mentioned, I've been looking into lots of ideas to put the empowerment and the education in the patient side. And a lot of times hospitals ask me, hey, on discharge or on our website or Facebook, can I have some resources that we can share with families to help them know how to access care, or for them to know when there's some red flags? Of course, we have post-birth, but what are some others? The Believe Her app is really, really good. I have used it. I've had some patients that have used it, and free resource, wonderful, wonderful content. Again, right there on her phone for those that again can afford a phone. Keep in mind that that's not everybody. But I really, really like that free app and encourage you to use that with your patients or to roll it out. The second, also focused in on connecting moms, but providing an online or app resource for support for expectant and new moms, is this mycheckonmom.com. And again, you'll look and see that there's lots of layers of opportunity, all free, readily available to moms 24/7. to assess if she's okay, to get her connected to resources, and to provide some online support for her. All feeding into the conversation that if they notice a red flag, that they get a resource and they get her sent to the next place. We shouldn't just make it about finding a provider. We should make ourselves more available to the patient or to the family that needs help. And these two apps do a great job of that. Next step on our to-do list, we're going to keep rolling. So hang in there with me today, guys. AIM. We've talked about AIM for a long time. Many of you or most of you know that we're now enrolled. And I said, nope, we're not just enrolled, we are rolling. So what does that mean? Remember, we are enrolled, the Kansas Perinatal Quality Collaborative is enrolled in the AIM bundle called the Postpartum Discharge Transition. I'm not going to go through every single piece of that. There are 3 components that I would ask for you to take a look at, and that is the specific bundle. There's implementation. That's kind of my gig. You can look through it and go, oh my gosh, there's a lot here. I'll dissect it for you. And then the third is the data collection piece. Just skim over it. I'll show you some examples here in a second. But what you'll see there is the overview of that AIM bundle so that you all know what that means for 4th trimester to be part of now or enrolled now in the AIM bundle. What does that really mean? So that sounds great, Tara. I'm glad we're enrolled, but tell me what that means for my facility, for my agency. The AIM Postpartum Transition Bundle talks about the 5 R's: readiness, recognition and prevention, response, reporting and systems learning, and respectful, equitable, and supportive care. Every unit, every patient, every event, and then the combination of those things. So what I've been working with Casey on and many other folks who are on the starting gate of this is making sure that the 4th trimester attacks or connects with the Kansas specific needs, what we identified through data collection and evaluation that we needed to focus on in Kansas. But how does it connect to the AIM goals? Well, here's how it works. As an example, under readiness, every unit, and under recognition and prevention, every patient. You all don't know it, but you're already fast forward on these outcomes. You're already doing this work. You're evaluating your postpartum protocols through maternal warning signs education. We're evaluating postpartum visit scheduling. We're going to standardize the discharge summary. And we're talking about navigation of patients from the inpatient to the outpatient setting based on screenings. We're working on creating universal screening across Kansas for medical risk factors, mental health or perinatal mood disorder risk factors, including substance abuse diagnosis, and most importantly, evaluating throughout the social and structural drivers of health. We're evaluating how we identify and how we refer all of those screens. If she screens positive, what are we doing next? It's not just good enough to screen her. We got to have a plan and process in place. As an example of a response to every event, what are we doing? It's called post-birth. It's why we hit that straight out of the gate. Everybody across Kansas should recognize post-birth, be able to find their magnet, find it online, find it on their phone, and say, okay, I'm having X, Y, and Z symptoms. What do I do next? Or, oh my goodness, my sister is complaining of this. What does that mean? And what do I do next to help her? The providers pick up the phone. Every staff member knows how to respond to these red flags, and we get things moving. So every event, every phone call, every triage is met with next step. Then again, we talk about, okay, every unit's going to need to evaluate, update, improve processes and policies. You don't need to read through this, but just know that I've pulled through the AIM specific goals, and Candace is nailing it with our starting gate. Discharge education, what does it look like to teach about warning signs? What is the summary of birth events, and how are we monitoring things when she goes home? That's all part of our process improvement in Kansas. We'll talk about, again, the discharge summary. We're going to have to work really hard, you guys, on making sure that when she leaves the inpatient setting or the birth center, that she's got a very specific summary that's shared back with her primary OB provider or is readily accessible to who she sees next. And then always remembering the respectful, equitable, and supportive care is embedded throughout. So again, the birthing person is included as part of that multidisciplinary postpartum care team, that there's trust, that there's bidirectional shared decision making, and that the patient values and goals are the primary driver. We have got to flip this and make this a big piece of our project. And again, you heard me say that that's a major goal in 2022. So again, just to bore you with a quick worksheet, just to know that it connects and to know we're doing the right thing here. Every single portion of our 4th trimester work, including KPQC learning forums, educating statewide, and then impacting locally, is connected to a very specific outcome, a way to measure it, and calculate improvement, no change, or backward motion. And so that's where we are right now. Again, as we're pushing through the initiatives, as we're pushing through the protocols and the education, know that I'm keeping track of the constantly moving wheel, and we're doing exactly what we should be doing. Maybe not perfectly, maybe not as fast as we want to, but we're doing everything that AIM is also recommending, which is wonderful. Plus, we're meeting our state needs. Let's just say that out loud. We need to improve Kansas first. The outpatient part, I've gotten asked a lot by many of our hospitals about, well, we're talking about the inpatient setting with the 4th trimester work, but the AIM postpartum bundle talks about connection to the outpatient setting. Remember, everybody, that we are paralleling our work with outpatient connections like maternal child health, through KDHE, through private providers and practices, through outpatient settings in hospitals and birth centers, and we will continue to connect dots as we get this program going. On their side, we have to educate and inform them about what to look for, how to make sure they have the tools that they need, and how to refer patients and move them forward. So let's take a deep breath for a second. Where are we individually right now? And if, for those of you that may be interested in joining us, what's really happening in Kansas in 2022? I'm going to let one of our bright spots in our project, who I've really enjoyed getting to know more and more since I joined this crew, the Kansas Connecting Communities folks. On the call, I know I saw Patricia. Lindsay may be on here too. But if we talk about red flags in Kansas, but also identified in the AIM bundle, what are our problems? How do I identify next steps in Kansas, and what are we doing about it? I would say KCC is the gold champion of this work. Patricia, you want to jump on and give us an update here, or whoever from your group?
Yeah, thank you so much, Tara, for that warm introduction and all of today's updates. It's really exciting seeing the scope of this work. Over the last couple months, like Tara has said, the Kansas Connecting Communities team has been engaging several of our FTI sites in some one-on-one and collaborative technical assistance focused on our perinatal behavioral health, screening, and referral implementation. And just a huge thank you to the sites listed here who have been working with us and also sharing some of their data so we can really hone in on what's happening. So thank you guys so much for getting that in. And we're looking forward in February to being able to share with the group a little bit more about what's happening with those sites and some of the overall data. Go ahead and move on to that. Yeah, next slide, Tara. Again, a huge thank you to this group. I think it's a testament to everyone's commitment to perinatal mental health, how responsive folks have been. So if you remember, I think mid-December, which isn't a great time for everyone, but we sent out an email requesting folks, our lead OBs, to complete a survey, and this group of folks have responded to that. So if you're not on this list and think that your OB provider did complete this, definitely let me know. Or if you know it's kind of on your OB provider's to-do list, you know, maybe we just look around and see Tara, who's not on that list, wink, wink. But if you are interested in filling that out, certainly let us know. We'll get to you either way though. And then Tara, do we have one more slide? I know I just had a few updates for folks as far as resources, perinatal behavioral health resources. So I certainly encourage folks who are involved in treatment planning or treatment planning and medication management to register for this series and hop into one of these sessions. We're going to be holding these twice monthly with our new Kansas peripartum psychiatrist, Dr. Erin Biter. If you haven't had a chance to connect with her via the consultation line yet or at one of these clinics, highly encourage you to. Her expertise, as well as the rest of the team who you might be familiar with at this point: Mel Hoffman, PSI Kansas chapter president, Lucinda Whitney, who helps with our technical assistance, and then Dr. Beth Aller, who's in Stockton, Kansas, as well as some guest speakers are going to be just building our provider confidence and knowledge as it relates to peripartum psychiatry, diagnosis and treatment management. Tara, I just had a few other updates I wanted to let folks know. I don't think I have this chat handy, but the KDHE perinatal mental health and substance use toolkits have been updated recently. So they're just going to look a little bit different. If you have that on your favorites tab, the link is different now. So I'm going to chat those here in a second, but definitely update those links and go ahead and take a look at what might be new in there, or just a refresher. And then, as always, the perinatal provider consultation line is available as questions come up, best practices, referral support, as well as that direct provider to provider consultation. Tara, have I missed anything here? I know we're going to be chatting a lot with folks in February. And again, Dr. Erin Biter is going to be joining us then.
No, again, I think we have to be careful about overanalyzing only one piece of our fourth trimester work. But I would tell you that maternal mental health and family mental health, and whatever definition of family is, I'm really happy. And I asked KCC to jump in February because I think that we are at a very important turning point, that resources are present and available throughout the state, but our patients still don't know how to access it. And I get the vibe from most of the facilities that I've connected with that this is still the hardest part. Identifying and referring on for maternal mental health, perinatal mood disorder, et cetera, and SUD needs our attention constantly. So Patricia, we're excited to have you all as our guests. Not really, you're not guests anymore, you're family, but to have you all as our focus point in February for specific next steps moving forward at your facilities. Patricia, thank you. I appreciate that update. So when we talk about, again, postpartum, and we decided where we were going to start, we knew that post-birth through A1 training was absolutely the best grab for us. And so here we are in 2022, educating surrounding the A1 post-birth warning signs. And remember, post-birth is just one piece of what we call the maternal warning signs, which encompasses the entire KDHE toolkit. It involves outpatient identification evaluation. It also involves inpatient identification, referral, et cetera, and education. So when we talk about post-birth, we're not just talking about a magnet. We're not just talking about something that you hand to a patient. You took the A1 training and we moved on. It's using that education both for yourself as a provider or as an educator of students or as a policymaker or as a bedside provider. You're taking that education, updating it in your brain, and then educating patients and their families about what to watch for. And then we're changing policy and improving outcomes. Where are we on the training right now? I'm really excited. Again, I know it feels like some days we're not moving forward as fast as we want to, but look at the numbers. 346 providers throughout Kansas have trained through the fourth trimester work, meaning they've received post-birth training through A1. I would also tell you, I think that's underrepresentative. I think that there's probably some training rosters that aren't in my inbox yet. That's okay. I'm excited to see when they come. But 346 have been officially trained in post-birth education and identification. Our sites, 4 trimester sites with the highest number of training participants: Community Healthcare System out of Onega, Amberwell, Hiawatha, Lawrence Memorial, University of Kansas State Francis, and Hayes Med. Phenomenal numbers coming out of those sites. The most departments that have been trained. Now remember, we know that the postpartum education and staff are our primary focus, but these folks said, yes, but. Yes, it should be also ROB folks. Yes, it should also be our triage folks. Yes, it should be X, Y, and Z, more ER, whoever it is, they involved more departments. Who's taking the lead on that? Hayes Med, Hutchinson, again, Community Healthcare System, Hiawatha, and Sabetha. Excellent, excellent work. Now, here's the moment where I say I need more. 10 sites have not submitted any training to me. So of the 27 that we have enrolled, I've gotten no training rosters from 10 sites. And I know that you've started the process. I also know how difficult staffing and education is right now. So this isn't a finger shake. It's just a matter of saying, I'm excited for you all to have your turn. Tell me how I can help you. And then pay attention to that next line. There are 191 free registrations sitting, waiting for you all. So if the University of Kansas says, I need 25 more registrations, get a hold of me, let's do it. If, anywhere, if any spot, any agency said, I'd like some and they're enrolled, get a hold of me and let's get that out. That also involves, remember, 1 CEU for each registration. We initially only allowed 3 per site, and then we had a phenomenal opportunity for funding, and here we go. So let's use them. Please, again, do not hesitate to use those coupons that you've been given already and ask me for more. Also, please submit your roster to me so you can get credit for all your hard work to train your staff. And remember, we report that at the state level, and we're reporting it at the AIM level as well. Great ideas that are coming. I just mentioned the departments and the multi-department involvement of post-birth. If you're sitting there thinking, I would like to do that, but I don't know how, there are some phenomenal ideas that are coming out of those groups that I mentioned above, but also just think creatively. How can you get those folks trained? It's all online to begin. And then how do you connect dots to make sure that everybody's on the same page with education and process? I've seen even just triage techs. So the folks that answer the phone, both in the inpatient and outpatient setting training, EMS services, and I'll come back to that in a minute. Urgent cares, any of those folks should be, and we encourage you to train them in your county. Again, they can use your training coupon, but let me know what's going on and I'll show you how to do that. Also remember that there's parallel work happening in the outpatient setting, so that the maternal child health group through KDHE is also training all of their sites, and to date 122 of them have been trained. So that just because we're educating them here doesn't mean that they won't be able to recognize the red flag when the patient arrives or calls on the outpatient side. Next step, post-birth continues. We've got to get that nailed down and get that done. We've got to get through the training in 2022. Next step is, okay, what did the data in 2020 and 2021 tell us that we need to also be focused on in 2022 as we're improving process, talking to patients, educating them on red flags, and moving forward? So as we talk about next steps and we talk about, okay, are we doing everything we need to be doing while we're embedding post-birth? I wanted you all to see a really quick, easy example of how you can look at your statewide data, but also your county-specific data to identify if what you're doing with post-birth and what you're doing with education embedding and process improvement, if it connects to what your county needs. The Kansas Health Matters information is easy to access. I'm going to pull this up right now. And Tiffany, if it doesn't load like we hoped, you let me know right away, please. But this website is a simple point and click where you can look up, like I said, state level data, which is what queues up right away. So you'll see me scroll down and everything. Such a great setup here to evaluate, for example, under maternal, fetal, and infant health, the infant mortality rate in Kansas compared to the US value, you see that listed there. Is it up or down from the Kansas or from the national level? Has there been any change? And then continuing across that row, what's the trend? What's the 2020 target and the 2030 target compared to where we are now? Percentage of women who are using nicotine. Again, there's the target, there's the current number. Where are we headed? And then as another one that they pulled out, percentage of births with low birth weight. Now, that's the state data. Here's the great part. And maybe I'm just a nerd about stats, but I like this stuff because it tells me what I can do at the local level. Let's pull out Douglas County and you'll see it load. Let's go down to maternal, fetal, and infant health. Look at that. So for your county, or perhaps you'd like to think about, okay, there's another county that's similar to us, and what are their numbers and how are they connecting? Again, there's your county specific information. What does it look like for your maternal, fetal, and infant health? What's your IMR rate? Where's your women who smoke in pregnancy rate, and what's your trend? What are some focused goals that you'd like to do? And this, without taking you through more and more pieces, there are a lot of options for how you can address specific questions or specific targets. All the counties are listed, but it even has you right here, search for indicators. So again, a resource that you can use at the local and state level to see what your numbers are and perhaps identify some focused endpoints. We talked also about things like maternal hypertension and the data and the rates for your county. Is it a problem? Is it not? What does that look like? And do you need to identify that as one of your goals for 2020? All right. And again, where are we in the process improvement? We are for education, but now we're also working through fixing processes. I don't need to hash this out again. Remember, what we're doing is evaluating policies. We're training. Each of you should be working with the KCC group, not just the specific TA sites about maternal mental health evaluation and process improvement, but what are you going to do next? But all of our fourth trimester sites have access to KCC, and direct work will begin again in February with them, with all of our sites. I want you to be thinking about how to connect to your outpatient settings. I want you to be thinking about an action plan, how you're going to embed post-birth, how are you going to look at your policy review, and how are we going to listen to our families? What are they telling us that they need? And how are we going to connect those dots? Always remembering again that we're training providers. Provider means anyone who has direct access to a patient. I would also say for those of you that are educating students, both, nursing, midwifery, physicians, radiology tech, anybody who is taking care of pregnant and postpartum women in our state are part of our work. We're training everybody that we know to identify and treat. No wrong door, remember? And then we're revising policies that tell us that we don't quite have it together yet. Let's fix that problem. Then we're focused also in on educating patients and families, connecting that to the outpatient and community, and then we're reviewing processes all the while. That's that QI continuum. What's working, what's not, and what do we need to reevaluate? This is your checklist for our fourth trimester group. You'll see this. I'm not going to read this to you. You can look through that when it comes out to you in a PowerPoint. But are you on track with where we need to be going next? If you need to take a pause, I've got a couple of hospitals that reached out to me and just said, Tara, we just can't right now. We want to stay enrolled, but we don't have the capacity or the staffing to be able to keep up with where we're going. And I actually answered all of them the same. Stay enrolled. We absolutely want you involved, and give us what you can when you can, and let me help you navigate how to get through this in terms of improving outcomes while you're overwhelmed. Just yesterday, our unit itself was overwhelmed, and babies were coming out of every door. Kayla is on the call and she was part of that fun. And in the middle of that, I heard our staff doing a QI process. In the middle of the chaos, I heard conversation about postpartum hemorrhage evaluation, breastfeeding rates, how we're going to evaluate someone for SUD and make sure she was referred. And that conversation was continuous. So I know you all at the bedside, and those of you educating people, are not just operating in a silo. So don't get too overwhelmed with the to-do list. I would just ask you, where are you? And where do you want to go next as an individual provider, but also as the enrolled or the interested party in Kansas? I will get back to this in an email to you. I just wanted that my fourth trimester sites to see this is how you keep track at your side of how you're going, how you're getting things accomplished through the first trimester work. It also is due to me every few months so that I know where you're at and I can help you with your process improvement, your education. How are you doing with handing out magnets? What are you going to do with the mom card when it shows up? So again, it's internal paperwork for you to keep track of where you're at. So you show a QI process improvement, but it's also for us to keep track at the state level where everybody's at. Reminder of where you're going next with post-birth was there. And again, you see that I still have the note to myself on the PowerPoint. This is the document that we put out several months ago, and I wanted to remind you about it. So lots of you, and we're going to talk about policies here in a second and spend the last bit of our time walking through some policies. We put out a plan for integration of the first trimester work into facilities, 2-page document that talked about from training through integration and policy adjustment, what that would look like. It's a very vague document, but it gives you important resources. If you don't have that document or you can't find it and you want it again, please reach out to me so that you know that you don't have to reinvent the wheel. We can help you with this integration. And this document's a good outline of how to do so. And that talks about the toolkit that again is embedded in that document. Magnets, the post-birth magnets. Once training is complete, remember, we want you to make sure you're embedding that part of your education to the patient with her magnet to go home for every birth that leaves your facility or your agency. And if you need more, if it's time for more magnets, let me know right away and we'll send those to you. Again, we talked about, we're also going to embed the mom cards so that she has a very specific thing with data about her birth and her baby going home that's readily available to everybody that might see her or need to know about her story. I'm going to stop. The last 15 minutes, I just want conversation about policy evaluation. Sounds boring, I get it. But I think all of us are asking the same question. Okay, we're training, we're making the process improvement of education on the provider side. We're ready to embed that education or have embedded that education with our patients prior to discharge. But our policy needs to be adjusted so we make sure that it's not just in 2022, but this is now the assumption of care change. I asked a couple of folks to send me or give me an example of their policies and where they're going to embed the maternal warning signs information, the perinatal mood disorder screening and referrals. How does that begin to roll out in your facility? I don't know if Chelsea James is on today, and if she is, please jump in here. But Hiawatha is asking the same question. Hey, I see your face, Chelsea. There you are. Will you jump on and just talk through what you and I's email was about?
Sure. We have implemented the post-birth warning signs, discharge instructions embedded for every patient and have those as standardized in every single discharge, and have reviewed the policy and note we have several gaps in our policy that doesn't maybe actually align with what we're actually doing. So hoping we can get lots of great resources to embed those standardized instructions for education, making follow-up appointments, and just putting some of that stuff in there.
Chelsea, let me ask you a question. What I copied and pasted from your information, I think that this is this the postpartum discharge policy, or what are we looking at?
Yes.
Yeah. So one of the things that I think everybody's struggling with, and you mentioned to me, was how many places do I need to put it, or what do we need to show up in the policy? What is your brain thinking right now about that, Chelsea? What do you think hospitals need, or what do you all need most in terms of a template idea from us?
Just having that, I think just having a template to work from on what should be there would be helpful.
Yeah, I'm hearing you. Other hospitals that are listening in, the birth centers, in terms of, if you look at and let me click on another one. So again, I use my own facility because we're right alongside everybody else trying to make changes. I asked, where is our standardized postpartum education list? And I got 2 answers. One was our electronic medical records through a checklist of things that need to be completed prior to discharge, but also it's embedded in the discharge instructions for mother and infant. But look where which department it sits in, which is the nursery side, right? And that's not where I expected it to be. And so this surprised me a little bit. And if you look under 1D, when it says the following symptoms should be reported to a medical provider as soon as possible, that's already there. That's post-birth, right? So I would encourage you all to look at your current policy and protocol, see where it sits, and just first of all, ask yourselves, where does it need to sit? Policies can be ad nauseum everywhere, but where do we need to put the template? How can we help you with the template? I hear you, but where else does it need to sit? I would love some more input on some facilities when you're looking at your own and trying to figure out, again, we're changing the dynamics of postpartum discharge education. Tara gives us a template or gives us more specific information to embed, but has anybody else done those things or has good information to share with where it sits within your policies on your postpartum side? You're all going to be quiet today. It's because I've talked too much. I get it. So here's the question. When we leave here today, I'm going to do some work on the template side. I see that the issue is where does the template and the postpartum policy adjustment need to sit? But again, I would also encourage you all to think, when we talk about maternal warning signs, we talk about where we're going to help women identify a red flag. How do we make sure that every patient is evaluated and educated and referred? Does that sit on your EHR, your electronic medical records side? Does that sit in a policy? And if it sits in those places, where is it correct? And where does it need to be updated? One other piece I wanted to show you all, which I may not be able to go backwards. Yep. So Lawrence Memorial is doing some really strong work as well on the post-birth side. Lawrence Memorial has 90% of their entire OB unit trained on post-birth. Their next step is to work on policy revision. So Emily let us know that on their agenda for this month's perinatal excellence meeting, which she's mentioned, I just copied and pasted her email. She mentions as part of the first trimester work, that's the focused group focused around this process improvement. They were going to talk about where to put it in the policy. What she's saying is that, again, we're not really sure where it fits on the policy, but we want to embed it quick. So we thought about it, adding it to our existing maternal child delivery of care protocol, which encompasses both birthing person as well as the infant side. Or does it go where the discharge information or discharge protocol is located? This is going to be important because in order for you all to show on your side and on the state side that we have a change of policy, and that now 100% of women are educated and evaluated and screened and referred, we're going to have to make sure it's across the board. And where does that exist? She's also mentioning that their postpartum depression screening protocol, which remember we use them as our pilot site, their hard work is now what KCC is taking across the state as a great example and a benchmark. It's up and running. The process is happening. But she said, hold on a second, our protocol didn't get adjusted. So now everybody that's new, staff members and providers, everybody that's at the bedside, we don't even have it in our protocol that this is part of our story. We're just so fast forward. I forget that we need to train people, right? So is it on your education protocol as well? And where does it sit? Where does it embed? And how is it more meaningful to the nurses? When Emily wrote that in her email, it made me, again, kind of like I noticed yesterday in our own unit, listen to what your staff is saying. Listen to what your patients are saying. It's not just about a policy, but where is it needed and what do we need to do next? Conversation or questions about that piece. I will do work, Chelsea. I'll see what I can do about a template as fast as possible, but I also would encourage shared feedback on what you all are doing or anybody that's already done this and how it works great for you. A1 does not supply the template. We looked at that. They don't have a post-birth template that embeds it into your policy as cut and paste as that is. But I think Kansas can work on a vague idea of a template so that you all can assimilate it to your own policies. Questions, concerns about that before we finish our hour together? Okay, last thing of the day. One more request for the chat to be open there, Tiffany, for me. I would love requests. It's kind of like I'm a DJ. I will take requests for learning forum topics for this year. In front of you, you have a general outline of who's coming. As an example, April, we have a couple of options for who's going to present in April, but I've got lots of openings and lots of options for dual topics, even within Learning Forum. What do you all want to hear about or learn about during our sessions this year? Always keep in mind that we will continue to have briefer conversations like we did today about process and education and where everybody is in training. But I want more conversation this year. I want to involve guest speakers that you all want to hear. So in the chat right now, give me 1 or 2 ideas for Learning Forum topics or guest speakers that you'd love to see this year. And Tiffany will get that and share that with me moving forward. Before we close, reminder that our next Learning Forum is February 22nd, always at the noon hour. I know it's not a perfect timing for everybody, but they are been shared. Remember, we especially on our new updated website, we are excited that they will be easier to find, these learning forums that have been recorded, and certainly the PowerPoint presentations. But for now, Tiffany's going to send it out to you along with the resource list. But we look forward to seeing you on February 22nd at noon. And then I'll open it up for any other conversation or comment. Just hear me say that, like I said at the beginning, new year, hard work, COVID, maternal mental health, staffing, funding are all the things that are swirling. But in the middle of the chaos, I hear it and I see it from all of you that we want to do a better job in Kansas for our families, our moms, and specific to the postpartum period. So jump on anybody, but if we're good to go, then thanks for attending. We look forward to seeing you next month.